Hello guys, John here from the Body Engineers, and in this video I want to explain the chest muscle and how to activate the chest with specific exercises. So first of all, I just want to explain kind of what the chest muscle does on the skeleton, and then we'll go into a video explaining kind of how you can activate the chest when doing any kind of press motion in the best way possible, also for push-ups, and then I'll do some demonstrations. So with the chest muscle, as you can see on this skeleton, this half skeleton here, the chest muscle attaches along the humerus on this line here, and then it's a fan muscle that will go into the clavicle. So some parts of it attach here, parts of it attach into the sternum, and parts of it attach down into the costal fibers or costal ribs here. So there's some main functions of the chest muscle is that it adducts the arm across, so it'll bring the arm across this way. It will also internally rotate the arm, so turning it in like this, because it attaches on the front of the arm. As this is going to pull, it will just twist like that because it's pulling from the front. And it will also, it does a bit of shoulder flexion from a more extended position for these fibers, the ones that go up in here, because as these fibers pull and they get shorter, the arm is going to be lifted up and towards the clavicle. And it also, the other function is it protracts the scapula as well. So it will, although the scapula doesn't really move very well on this skeleton, it will go from a more retracted position, and because of the pull of the chest, it will bring the shoulder blade around the ribs, and that's one of the other functions of it. But then one of the main functions that we're going to focus on in this video is horizontal adduction, which is probably the main function of the chest muscle. So this motion, bringing the arm in from this position, which is like a chest press, and you're bringing the arm across. So one of the main problems that people you need to focus on, I guess, when targeting the chest muscle in any kind of exercise, is bringing the arm across versus kind of more of a punch, where you're going to be, where you're training it in protraction, but you're also adding in some other muscles into that motion. So in the next video, in a second, I'm going to show you on the whiteboard exactly how to activate this muscle in the best way possible, for a dumbbell or barbell press, and also for push-ups as well. Okay guys, so when it comes to activating the chest muscle in a dumbbell press or any kind of barbell press, I've got two different pictures here. So this is a picture of the ribs from this view. So if you see the skeleton here, this is the back. Essentially I'm drawing it where you're looking this way. So you can see the ribs, you can see the shoulder blade, and you can see the arm when it's out to the side like this. So with this view, you're looking from sort of head would be here, and then looking down, so you can see the rib cage, you can see the spine here, the sternum, the scapula, the humerus, and the elbow. So obviously this is not the best picture, but hopefully you get the idea. So what we have here is you have the scapula, and I've shown it in two different positions where the shoulder blade is protracted, so where the shoulder blade is more around the ribs, where this shoulder blade has gone kind of more around, versus being kind of in a more retracted position. And really what I'm trying to demonstrate is how having the shoulder blades retracted during any kind of pressing motion is going to activate and really help to sort of utilize or force you to use the chest more compared to some other muscles. So when you look at this picture, you have the spine and then you have the scapula. So in between the scapula and the spine, you've got one of the main muscles that brings the shoulder blade towards the spine is the rhomboids. It's one of the scapular retractors. And then you've also got some of the other muscles, such as the serratus anterior, which attaches on the inside anterior part of the scapula and then goes around the ribs a bit. So as you can see, if you go in a more protracted position, the serratus anterior has to work harder to keep the shoulder blade in that place. And so then when you're pressing, when you're pushing up and then you're allowing it to protract, this serratus muscle is going to have to take a lot of the load of the weight of whatever you're lifting. And another thing to look at is this angle of the pec major. So this is the one of the main chest muscles, which is going across here, attaches into the sternum, so it's the sternal fibers, and then attaches into the arm, sort of roughly midway down. So you can see the angle of this is smaller, particularly if you think, when it's not retracted, it's going to be, you know, like it's more sort of in line with that sternum. So whenever the angle gets smaller like that, because it's you're thinking of the component which is actually lifting the arm straight up, you're going to have quite a compressive force, because this muscle is going in this direction. As it's going in this direction, it's going to, because of that angle is smaller, it's going to be quite a lot of force compressing the joint, which may not feel good if you've got some sort of osteoarthritis or any kind of shoulder problem, whereas another component is going to be going in this direction. So you can, if you imagine this line of force here, and then you have a component of that here and here, and so because this angle is smaller, this component is going to be a bit larger versus this one. This is the one that really matters. This is the rotational one, which is going to actually move the arm up and actually move the weight. And so this is one of the main problems. And also you can see that there's another muscle here called the subscap, which is going around. It's going from the front of the scapula as well, and then it kind of goes around into the front, and you can see that the angle of pull for that is not great either, and so it's not going to be able to help with this motion. If you compare that to then being in a more retracted position, when the rhomboids, where your shoulder blades are fully retracted together, and then you're trying to bring the elbow across with the shoulder blade retracted, you can see that the angle, like with this great picture of mine, you can see that the angle is gone larger, and so the chest is going to be activated a lot more to bring the elbow across. So you can see there's going to be more component going in this direction versus this one, and also the shoulder blade is not going to be so much reliant on the function of the serratus anterior to keep the shoulder blade in position. So having it in this position is a much more stable position, and it allows for a solid anchor, so it keeps this scapula still, and so you can really, the shoulder, the arm is fully focused on having to use the pec major versus some of the other muscles to actually lift the weight up. And so this is going to really focus on having to use this muscle more versus having to use like the pec major, the serratus anterior, and like the pec minor, which is here, which also protracts the shoulder around as well. So it just avoids using some of these extra muscles, so you can really target this muscle. And also it's going to be a much healthier position for the shoulder joint as well, because this is much more powerful muscle, it's stronger, and you're also really forcing it to use that muscle during the motion. So that's just really a little explanation of why you really need to keep the shoulder blades retracted as you're trying to lift the weight, and not trying to think of protracting. So if you think of protracting the weight up, you're going to lose the pull of the chest, as you can see here, and also you're going to incorporate a bunch of other muscles which may not be able to withstand that kind of force that you're using or that weight you're using. So just make sure that you try to do this while you're doing a chest press.
The Body Engineers.